All right, everyone, settle in. Let's get right to it. Today, we're talking about something you are absolutely going to see on x-rays, something that might make you a little nervous at first, that mysterious shadow in the jaw. But trust me, by the end of our time today, you'll be able to look at that shadow with a ton of confidence. So imagine this. You've got a patient in your chair for a routine exam. You throw their x-rays up on the screen and boom, there it is, a dark round spot just hanging out in the bone. So what's going through your head? Is this an emergency? Is it something we just watch? That's the exact question we're going to figure out how to answer today.
So here's our game plan for this diagnostic mission. We'll start with the basics. What even is a cyst? Then we'll get into the cysts that are born from teeth and the ones that aren't. We'll even meet a few imposters that like to trick you. And finally, we'll wrap it all up with a diagnostic checklist you can use for any case that comes your way.
Okay, first things first. What are we actually looking for when we see these shadows? Understanding this is, well, it's pretty fundamental. This is bread and butter stuff you'll see throughout your entire career. Here it is. The one definition you've got to burn into your brain. A true cyst is an epithelium-lined sac. Got it? Think of it like a tiny, perfectly contained balloon inside the jaw, filled with some kind of fluid. That lining, that epithelial lining, is the key. It's the calling card that tells a pathologist, yep, this is a true cyst.
So all these things we see fall into three big families. First, you've got your odontogenic cysts. These guys come from all the stuff that makes teeth. Makes sense, right? Then you have the non-odontogenic cysts, which are basically little leftovers from when your face was fusing together as an embryo. And finally, you have the pseudocysts, the fakers. They look the part on an x-ray, but they're missing that all-important epithelial lining.
Let's start with the group you're going to encounter the most, the odontogenic cysts. Whenever you see a lesion near a tooth, these guys should be at the top of your suspect list. And here he is, the undisputed king, the #1 most common cyst you'll ever see, the radicular cyst. This is the classic lesion that pops up at the tip of a dead or non-vital tooth. You know the story. A cavity gets out of hand, the pulp dies, you get an infection, and that inflammation wakes up these sleepy little leftover cells, the rests of molasses, and tells them, hey, time to make a cyst. Now, listen up, because this is probably the most important clinical tip I can give you today. If you see something that looks like a cyst next to a tooth root, you must do a vitality test. Why? Because if that tooth is non-vital, you're almost certainly looking at a radicular cyst. But if that tooth is perfectly healthy and vital, you might be looking at something totally different, like a lateral periodontal cyst. That one simple test is the fork in the road for your diagnosis. Okay, next up, the dentigerous cyst. The easiest way to think about this one is like a little water balloon that's wrapped around the crown of a tooth that hasn't come in yet. It's basically stopping that tooth from erupting. You're going to see this all the time with impacted wisdom teeth and those stubborn maxillary canines.
You know, most of these cysts, they're pretty straightforward. You deal with them, they go away. But there's one that doesn't really play by the rules. This is the one you need to be watching out for. It's a true master of disguise.
And the reason you have to watch out for it is because this thing has a nasty habit of coming back. Its lining is super thin and delicate, and it likes to leave behind these little satellite cysts. We call them daughter cysts. So you can't just scoop this one out and call it a day. It needs a more thorough approach and definitely long-term follow-up to make sure you got it all. I'm talking about the odontogenic keratocyst, or OKC for short. This thing is a radiological chameleon. It can look like a radicular cyst, a dentigerous cyst, pretty much anything it wants to. It's aggressive, it loves to recur, and here's another huge clinical pearl for you. If you ever see a patient with multiple OKCs, you need to be thinking about basal cell nevus syndrome, which is a much bigger systemic issue. Okay, we've nailed the cysts that come from tooth tissues, so now let's switch gears. Let's talk about the cysts that pop up from other stuff, usually little bits of tissue that got left behind when the jaws were forming way back in the day. And the rock star of this category has a great nickname. It's super memorable, which is pretty handy when you're trying to spot it on an x-ray. This is the nasopalatine duct cyst. You'll find it right in the midline of the upper jaw between the two central incisors. And crucially, those incisors will test vital and healthy. Now, about that heart shape. It's a super cool illusion. It's not actually heart-shaped. You're just seeing the shadow of the anterior nasal spine laid over the top of a round cyst. Pretty neat, huh?
So we've met the real cysts. We know what makes them tick. But you ready for a plot twist? Sometimes what looks like a cyst, what acts like a cyst, isn't a cyst at all. Welcome to the world of the imposters. So you see that classic dark, round lesion on the x-ray. Your brain immediately goes, okay, that's a cyst. But hang on. What if it's missing the one thing that is required to be in the club? Remember our number one rule? That epithelial lining? Well, a pseudocyst is a hole in the bone that just doesn't have one. It's an empty space. Or maybe it's filled with blood, but there's no official lining. And that distinction is a total game changer because it completely changes our treatment plan. And the textbook example is the traumatic bone cyst. We think it happens after a knock to the jaw creates a bleed inside the bone that doesn't heal quite right. Its signature look on an x-ray is this gorgeous, scalloping shape. It looks like it's delicately arching up in between the roots of the teeth without damaging them at all. And of course, those teeth are always vital. It's a very unique look. Whew. Okay, we've met all the players, the usual suspects, the weird ones, and the imposters. So now let's put it all together. Let's build a simple, systematic way for you to figure this out in the clinic. This right here is your 4-step cheat sheet. It's that simple. First, location, location, location. Is it at the tip of a root? Is it wrapped around an impacted tooth? Is it in the midline? Second, and you can never ever skip this, what's the vitality of the teeth next door? That simple test can solve half the puzzle right there. Third, look at the x-ray itself. What's its personality? Is it a perfect circle? Does it have that classic scalloping? Do you see a heart shape? And fourth, talk to your patient. Get a good history. Any trauma to the jaw? Any missing teeth? Ask these 4 questions every single time and you'll nail the diagnosis. So the next time you see that dark shadow on a film, don't feel that moment of panic. See it as a puzzle. You have the knowledge now. The x-ray is giving you all the clues. You're the detective. The only question is, can you solve the case? And the answer is, yes, you absolutely can. Fantastic job today, everyone.